This video continues Chapter 17 of OEC 6, and we're going to really focus on obstetric emergencies that can occur. So specifically, when we look at the objectives, this is Objective 17.6, the complications of pregnancy. And some terms that we'll encounter will be preeclampsia and eclampsia. We'll look at ectopic pregnancies and placenta previa. And I forgot to highlight one, we'll talk about abruptio placentae. Let's begin. An ectopic pregnancy is a very serious situation, and that's when a fertilized egg implants outside of the uterus, most commonly in the fallopian tube. Remember that fertilization will occur in a fallopian tube, but then the egg will continue its travel and embed in the wall of the uterus. If it doesn't complete that travel to embed in the uterus, then the developing fetus can actually develop inside the fallopian tube, which is pretty narrow. It doesn't have room for that development, and the tube can eventually rupture. You can imagine that this will cause major internal bleeding with the potential of moving towards a hypovolemic or hemorrhagic shock. One of the signs and symptoms of this can be referred pain in the left shoulder, along with some of the other things that we would see, just some of the spotting that can occur early on. Miscarriage is the loss of a pregnancy prior to 20 weeks of gestation. So we're looking at about a trimester and a half. Any fetus developmentally that is less than 24 weeks along in gestation will have little chance of survival. So we see some of the symptoms for this. Spotting or bleeding is a primary symptom, and this can happen to roughly a fourth of all pregnant women. Placenta previa is a condition in which the placenta is implanted abnormally low. So after fertilization, the traveling of the egg through the fallopian tubes to the uterus occurs correctly, but the implantation is going to be abnormally low rather than being on the wall of the uterus. And so consequently, the placenta covers the cervix, and this can result in termination of the pregnancy. Now, another thing to consider is a traumatic injury that may occur. And in this case, typically women may stay active the first couple of trimesters. And so traumatically, if they get a tear in the muscular wall of the uterus, again, we need to be very concerned about the bleeding that can occur. And realize that we have two patients here. True emergency. Shock can occur to both of these patients very rapidly. Abruptio placentae is a shearing injury that can happen. So we've considered when we looked at, for example, thoracic trauma, what may happen to the aorta of a patient who, for example, strikes a tree and that aorta continues to travel and a shearing force is produced. Well, imagine in this case, we'll just drop it a little bit lower. We'll move towards the abdomen and the pelvis in the situation of a pregnant woman. And so we get that sudden stop. The body stops moving before the internal organs, and in this case, specifically the uterus. And so what happens is that shearing force basically shears away the placenta from the wall of the uterus. And so classic signs and symptoms, again, vaginal bleeding and abdominal pain, but it's going to be accompanied by constant uterine contractions. And because of the internal bleeding, the uterine is actually going to move up inside that abdominal or pelvic cavity. We can get rupture of the amniotic sac. Normally this will happen just before birth occurs, but if it happens prematurely, we'll see the clear amniotic fluid leaking from the vagina. It can occur spontaneously, but most often occurs following trauma. Preeclampsia is the next condition to consider, and it's a hypertension. So it's a high blood pressure that develops during pregnancy, and it's after the 20th week of gestation, more common in a first-time pregnancy. One of the things we can do to assist is make sure a woman is on the left side, just because of the location anatomically of the vena cava. The uterus can start to compress that. We take pressure off by putting the patient in a left lateral recumbent position. This may be accompanied by some swelling in the face or hands, but once again, it's this pregnancy-induced hypertension or high blood pressure. Now, eclampsia is that pregnancy-induced hypertension complicated by seizures. It's a severe form of that high blood pressure, and that happens very late in the pregnancy, close to the time of delivery. The last condition to consider is gestational diabetes. Always be concerned that gestational diabetes could be occurring when a woman is pregnant, and they might present with symptoms of hyperglycemia, polydipsia, polyuria, and so on. Our care is going to be the same as for anyone who has diabetes, but we need to make sure that we refer the patient to a qualified medical professional. Follow-up care is going to be critical. After delivery, the woman's blood sugar levels will return to normal.